It was my first pregnancy, and all along, I had a birth plan in mind. I knew what I wanted, and my doctor at the time, I thought, was on board with it.
The United States has a maternal health care crisis. According to a lengthy National Public Radio investigation last year, U.S. maternal mortality rates are increasing, while in other countries the numbers are declining. In fact, 49 other countries have lower mortality ratios, including almost all European countries, Canada, and several countries in Asia and the Middle East.
I was one day past my due date, and his heart rate was low. And a snowstorm was coming that night, and Christmas was the week after. So I felt very rushed into the C-section. I felt like no one wanted to sit down with me and take the time to explain other options I may have had.
But that's not all. According to a study from the Centers for Disease Control and Prevention, Black women who give birth in the United States are dying 3 to 4 times more frequently than any other race. For every 100,000 Black women who give birth, 44 will die, compared to 12 deaths among white women. Stony Brook obstetrician Diana Guerrero says the reasons are complex.
Just an odds ratio. So morbidities can be any of those things, right? So
really, we don't know what exactly it is, because yes, there are certain diseases like chronic hypertension, so high blood pressure is a little more common in a younger woman who is a Black woman.
Like Guerrero, most doctors have a clinical perspective on this crisis, while Black patients frequently blame it on the structural racism within the healthcare system, notably implicit racial bias.
The bedside manner toward African American women can be better. I feel like our pain is not felt the same as if I was another race.
An expert on implicit bias gives an example of how implicit bias can manifest in healthcare.
One of the things that I noticed is as we learned more about HIV and came to learn that you're not going to get it from sitting across the room from another person, that there really needs to be specific behaviors that lead you to get HIV. The implicit bias creeps in because now we're talking about behavior. And when we speak about behavior, people have biases against certain behaviors. And how does that manifest as a physician? If I'm a physician and I know that my patient engages in, if it's a male, and that male engages in unprotected sex with another male, and I have feelings about that, my own personal values about that, my implicit bias might lead me to either be overly sensitive or more often less sensitive or less willing to work with that patient.
Kincaid happens to be tragically familiar with maternal mortality. In 1978, her older sister, who was 18 at the time, had a perfectly normal pregnancy, yet died after giving birth by choking on her vomit.
I often ask myself, why didn't she get the attention that she needed? Why was she left alone? Why was she left alone?
Kincaid's mother filed a lawsuit against the hospital, and the hospital was found negligent. Kincaid says she believes her sister's death was a result of implicit bias. She says if her mother had not taken action, the hospital would never have been held accountable.
That was a result of my mom knowing. If my mom had not known, no one said to her this was a mistake. My mom had the wherewithal to know that this was wrong, and she took it upon herself to follow up with this.
Black women have charged that medical caregivers of a different race often have not taken proper care of them. Carice is now a mother of 2 young boys.
I just felt like I was being rushed. I didn't have time to even get my thoughts together. You have to have a C-section, we're rushing you in. Like, it was very quick, it was very abrupt. My doctor wasn't even there. It was somebody else from his office who I had never met during my entire pregnancy, who was telling me he was about to cut me open and take my baby out.
Heather Finletter Hines is a midwife in the clinical practice of OBGYN at Stony Brook University Hospital.
We need to take the face out of the disease. And I'm going to just be point blank.
Heather says she hasn't seen implicit bias at Stony Brook University Hospital, but that doesn't mean it doesn't exist elsewhere.
If a woman comes in with a vaginitis, treat the vagina. Don't look at the woman. Let's screen everyone and take care of everyone on the same plane. We should also do that in preconception and pregnancy care, GYN STD screening. Treat the diagnosis, treat the problem, take the face out of it, and if we do that, we'll be having a better healthcare system.
California Democratic Senator Kamala Harris introduced legislation to combat racial disparities in maternal health care. Her bill will include implicit bias training for all healthcare providers. For Stony Brook News, I'm Tiffany Golding.